wanted to go back to, I believe it was the third point that Stephanie Watkins from HAP made, and expand on that, as well as talk about some broadband issues and follow up on Senator Hutchinson's line of questioning. Stephanie, I think you spoke, your third point that you made was silver linings, and that was regulatory red tape reductions. There's been a lot of innovation. There have been a lot of decisions with regard to rescinding regulations that would hamper the effective treatment of patients in these unusual times and circumstances. And there is legislation pending that I drafted that would provide for a 5-year systemic overview of every regulation in place on the books in Pennsylvania, which is copious. It's over 153,000 regulations. You know, is this something that HAP and the hospitals support going forward to look comprehensively at those regulations so that we can help enhance what you're doing, recognizing that the challenges hospitals face are not going to go away even once the COVID virus goes away?
Yeah, sure. I think that would be something that we have and our members would welcome. I know, you know, currently, just kind of related, there is a process of reissuing the hospital regulations that have been has been an ongoing process, which, you know, has taken years, and we're still not there yet. So we would definitely welcome that opportunity, Senator.
Thank you. And to follow up on Senator Hutchinson's question, telemedicine. Most people in my district are served by WellSpan Health, and they've shared really dramatic statistics with me. In 2019, they treated patients through telemedicine services. They treated 1,900 patients in 2019. In the months of April and May, they were averaging 1,900 telehealth visits a day. So from 1,900 in a year to 1,900 in a day, really, really dramatic. But one of the things that they have shared with me is that telemedicine services are hampered by a lack of connectivity by patients. Also have heard from our Visiting Nurses Association that when they're out in the field, connecting to patient records, systems like Epic in certain areas of York County are really difficult. So what are you experiencing in Greene and Washington counties in the areas that your health systems serve in terms of connectivity with your patients?
In Greene County, I'll tell everybody that it is a struggle for communications. We just don't have that broadband. We don't have that capability as much as we do in Washington County. We've struggled for some of our family practices to be able to connect with patients during COVID in Greene County. Families and households, there's a lot of them that just do not have broadband and that internet capability.
And certainly, you know, we are working on that diligently, and recognize that for the future, we're going to need to do a better job connecting people to the internet so they have access. You know, oftentimes people say, is this just about Netflix? And it's about so much more. It's about people's pacemakers being able to connect digitally to their doctors. It's about those nursing home patients and post-operative patients being able to connect with their physicians. So we will continue to work on that. And I appreciate hearing that from you. Thank you, Chairman Argall.
Chairman.
Yes.
over here. Can I just, one of the
Please.
things that we are looking at in Washington County with the CARES Act is doing, because of the broadband issues, hotspots in community areas where people can go and connect with telemedicine. They can go for school assignments. So we're trying to do that. We can't address the larger issue of broadband because the money has to be spent by the end of the year. It's too big of a project to be able to tackle all of that at once. But we are looking at hotspots in community areas.
If I could add on to that, in Greene County, like Terry mentioned, it's a struggle, and we think 40% of our households don't have the capability. And telemedicine is one thing, but the smaller population that's involved in that, you can work around and get them around. But we're talking about all 5 of our school districts now going back on a hybrid program where they're going to have to teach at home as well. So there's a potential that 40% of our students don't have that same capability. So I think the argument, this is a valid argument for telemedicine, but the argument is bigger in full capability of broadband throughout the spectrum of requirements, whether it is Netflix for entertainment or education or telemarketing. And it is important. We're working on the same kind of programs down there in Greene County now it's a forced issue, because we can't accept 40% of our folks not being able to be educated.